I want to talk about the difference between food sensitivity and food allergies. When we have a food allergy, we usually know it right away. You eat a food and your body has a reaction pretty quickly. This has to do with the IgE antibodies. A food sensitivity, on the other hand, has to do with IgG antibodies, in which it is a delayed response. For instance, I could eat something on Saturday and I wouldn't have the response until Tuesday or Wednesday. So it is a different test, and usually the allergy test is done at the allergist or by another physician. Over here we do the food sensitivity, which is the delayed reaction. We use the ALCAT testing kit. And it's a simple blood test. What we do is expose your blood to different kinds of food. If there's a reaction in the tube, there's a reaction in your body with inflammation. So that's how we see what foods you have a sensitivity to. For the test results, it looks like this. There's a severe intolerance, moderate intolerance, mild intolerance, and then those foods that are acceptable. So it's very comprehensive, and you can do different panels, 100, 150, 200 panels, depending on what you eat. I usually let the patient choose what they like. The severe and moderate intolerance columns, we stay away from that for at least 6 months. It's going to start to reduce that inflammation on that intestinal barrier. The mild intolerance can be rotated with those foods that are acceptable. A 4-day rotation diet is given along with the results of the food sensitivity, and what happens is this is very personalized. They take those foods that you can eat, that you have no intolerance to, and they take the mild intolerance group and they will mix them together and rotate them for you, so you'll have your own diet plan available. There's different ways to do this. Some people decide they just want to eat foods from those foods that are acceptable in the green column, and once in a while they will take a food from the yellow column, which is a mild intolerance. So there are different ways to do this. You can either follow the rotation diet or just follow from the foods that you can eat on a regular basis. This test also checks for gluten and gliadin, the proteins in wheat, rye, oat, and barley. Also, it checks for whey and casein, which is found in cow's milk, goat milk, and cheese and such as this. So it's very comprehensive. And if you want more information about the digestive system, you can go to our book, Chapter 6, in Imagine a Whole Different Kind of Medical Care. Or you can go to drmarcantel.com, our website. Thank you for listening.